Hey, I'm Dr. Geoffrey. We're going to jump right into it. The top signs of a stroke and what is a stroke in 5 minutes or less. Did you know that in this country, someone has a stroke every 40 seconds? There are many different types of strokes, but the most common type is called an ischemic stroke. An ischemic stroke. And that's basically a sudden loss of blood supply to a part of the brain. Sudden loss of blood supply to a part of the brain. And brain cells begin to die within minutes. Within minutes. And there are 5 top risk factors. One of them are diabetes, high blood pressure, obesity, smoking, and something called hypercholesteremia. In other words, your cholesterol is really, really high. Now, there are top signs for a stroke. There's a mnemonic called FAST. FAST. Number one is face. Is there facial weakness or facial asymmetry? In other words, when the patient smiles, do they have a regular smile, or is it a facial droop? Like, they're smiling, but only part of the face is going up. There's a facial weakness, and it can be on half the face or the full face, meaning one side. Then the next one, A, for arms. Is there any arm weakness? When you tell them to raise the arm, are they able to raise both arms or not? Then the S, speech. Do they have difficulty speaking? And let me add one, although it's a part of it, but it's not regularly highlighted. They say the same thing over and over again. Yes, the same thing over and over again, and they can't help it. And then the T is call 911. Call 911 right away. 2 additional very common signs are sudden dizziness, and believe it or not, hiccups. So all of a sudden they have uncontrollable hiccups. And here it is. Often the person who's having the stroke may not notice these symptoms. The person having the stroke may not notice these symptoms. And the reason why it's so important to call 911 right away or get them to the closest ER right away is because there's a 3-hour window. There's a 3-hour window where, as a board-certified emergency medicine physician who still practices, there's a 3-hour window where the ER, they've got 3 hours from your initial symptom to give you a certain type of that medicine, which will help you, which will help open up your blood vessels. It helps open up your blood vessels. And if you get this medicine within 3 hours, the likelihood of you having a better outcome is much greater. It's much greater. And yes, there's only a 3-hour window because outside of that 3 hours, studies show that if you give that medicine, you're more likely to do additional or more damage. Hence, calling 911 right away is essential. Several times I get patients say, well, I wasn't sure, didn't want to call 911. Listen to this part. When in doubt, call 911. When in doubt, call 911. And you come to the ER, we treat you, or we will assess you. If you're not having a stroke, guess what? You're gone. But if you're having a stroke, we can treat you. We can get you admitted to the hospital and get you all the services that you need. Now, the next question usually is, well, I'm outside the 3-hour window. I believe that I had a stroke. Should I come in? Yes, you should still come in. Let me tell you why. You'll still need to be admitted. Physical therapy, early physical therapy, it's very, very important. And then we must find out why you had that stroke. And there are conditions that we can treat right then to help prevent you from having a stroke right away. Hey, if you found this video helpful, and yes, this is a cut to the chase, emergency medicine, what is a stroke and the top signs of a stroke video. If you found this video helpful, be sure to comment, follow, or like, and join me for the next video where we will be discussing the top risk factors for strokes. Again, the top risk factors for stroke besides the 5 that I mentioned, and the top foods to help prevent a stroke. I'll see you in the next video.